It's physical as well as mental, so it's hard to just stop for like the right reasons.
I don't know too many people that have successfully beat it.
They're talking about heroin. It's an issue for law enforcement, educators, and you. We devote all of First to the topic this week.
Welcome to First. I'm Shirley Min. Mark Eichman and Nichelle Polston will be along in a bit. There are many facets to the heroin issue in the first state. We begin with the Delaware Department of Correction. It's changing its approach when it comes to addressing addiction and recidivism among its population with a new program focused on female inmates who are pregnant and struggling with substance use disorders. Here's our first look.
I started with Percocets, and then
started off small, doing a pill here and there.
That addiction gets kind of expensive, so you move on to heroin. That's just how it seems to happen.
Heroin was cheaper and easy to get.
It just escalated very quick.
Robbery, assault, and conspiracy.
I did the burglaries to keep up with my habit.
You kind of lose sense of what's right, what's wrong.
In trouble with the law, these three women are not only fighting addiction for themselves, they're fighting for their babies. But they're not doing it alone. The ladies are part of a pilot program called New Expectations, a treatment program for pregnant women with substance use disorders, the brainchild of the Delaware Department of Correction.
One of the things I realized was that some of the ladies that were in prison were actually sent there by the judge because they knew she was pregnant, they knew she had a substance use disorder and addiction, and they wanted to ensure that that child was born healthy and that the mother attained sobriety.
A noble mission, especially since judges in the state didn't have an alternative until now.
The program's an opportunity for them to get treatment and get clean and stay with their baby and not have to serve time in prison as a result of that relapse.
Partnering with substance abuse treatment provider Connections, the goal is to interrupt the cycle of addiction and give these babies better starts at life.
The benefit for the mother is that she can be in a safe, healthy, nurturing environment that's much more comforting than a prison environment. And then she doesn't have the trauma of being separated from her infant at birth. And the benefits for the baby are tremendous. There's a lot of research showing that it's very detrimental to babies even later on in childhood to be separated from their mothers.
The women live together in a group home in Newark. We're not talking jail cells, but the women were sentenced to New Expectations, so they can't come and go as they please. The kitchen is locked, and cell phones or cash are not allowed, house rules. Every weekday, the residents are taken to the Connections Clinic in Newark for required substance abuse group counseling. They're also required to take parenting and budgeting classes, to name two.
It's not a prison. You're not locked up. It's actually like they cater to you here. And I don't want to say that as being like spoiled or anything, but they actually fulfill and meet every need.
Tina Hearn had baby Noah in January. The program allows the 34-year-old to stay until Noah's 6 months old while she continues to work on staying clean and sets up things like housing and lining up a job once she graduates from the program.
You're getting help for your addiction and you can have your baby. You're not in jail and have, your baby taken away.
And just like they would at Baylor Women's Correctional Institute, the residents receive full prenatal care. Erin Jacobs is getting an ultrasound at Delaware Center for Maternal and Fetal Medicine. She's expecting a boy in mid-April.
It might sound weird because it's like a program and it's court ordered, but I'm happy.
The DOC's Director of Behavioral Health, Judy Caprio, believes addressing underlying issues will also interrupt the prison system's revolving door.
People are coming into prison with some issues. And if you look at substance use as a disease, much like you do with, diabetes or heart failure, then maybe that person wouldn't have been in prison to begin with.
Having an alternative to incarceration also makes fiscal sense. 2014 numbers show the DOC spent $36,000 per inmate to keep an individual behind bars. Based on a full house, which is 17 women, that figure drops to $17,000 per resident, a $19,000 savings.
As far as recidivism goes, we hope that because of the bond that the mother makes with the child, she realizes that there's more important things than oneself.
Instead of making your life about a drug, like, that's what I'm going to try different, you know? Make my life, like, more about my family.
I've learned that I'm a fighter, and it takes a fight for you to stay, you know, humble and in recovery.
You just gotta stay strong and stay on the right path.
The way the DOC explains it, the individual needs of the women outweigh the risk they present to the community. So someone who's committed a violent crime is not a candidate. The state has 3 years of funding to keep New Expectations going, but the DOC will do a cost-benefit analysis at the end of the year to determine the program's sustainability. That being said, the DOC is confident the program can be successful and could be expanded to other targeted groups, male or female. Delaware Attorney General Matt Dehn and Department of Health and Social Services Secretary Rita Landgraf are with me now. Thank you so much for being here.
Thank you.
Thank you.
Our interview is coming on the tails of the New Expectations story, where that program is trying to attack recidivism, but also another underlying issue of addiction. And Rita, I want to start with you. And DHSS has asked the state for an additional $4.5 million in funding. It's the only additional funding that the governor has requested in his budget. What does that say about the severity of the problem of addiction in our state?
Well, we now recognize that addiction is a disease, and it is at epidemic proportions, not only in the state of Delaware, but actually across our country. So indeed, we need to address this by promoting more treatment and recovery for individuals who are challenged by the disease of addiction.
And are the chances good that your department will get all $4.5 million?
I'm very hopeful. You know, I know the state is starting to face yet another issue relative to the finances, but indeed, whenever a state faces an epidemic, we do need to respond.
Steps are underway to fill in what are called gaps in the drug treatment system. You know, we're talking about expanding some residential beds, opening a new detox center downstate. Matt, are we obviously, I know that when you were campaigning for Attorney General, your big thing was addressing the underlying issues, and substance abuse being one of them. Are these are steps in the right direction, but what more do you think the state could do to address the problem?
Well, the ideal is that we would like people to be able to get treatment before they have contact with the criminal justice system. And I think I give the governor and Secretary Landgraf all the credit in the world for proposing that we expand the treatment availability, because that is key. You're right that it is also, aside from it being a human tragedy, it is also a driver both of violent crime in terms of the sale of the drugs, and also property crime. If you talk to a number of our law enforcement agencies throughout the state, they will tell you that a substantial amount of the burglaries and other types of property crime that are happening are being caused by people who are looking for money or property to support a drug habit. You know,
have you met with law enforcement agencies about how to maybe cut off the supply coming into the state?
Constantly. And the good news, there's a variety of good news, I think, early on, maybe the most significant of which is that our partners in the federal government, the FBI, the DEA, are much more involved in Delaware than they have been in quite some time. Just a week ago, we had 2 major heroin dealers in Wilmington who were arrested, which was the result of a task force that was led by the FBI, involved a number of local state law enforcement agencies in our office. We want to work our way up the chain with some of these cases and not just get the folks who are dealing on the street, but get some of the folks who are generating the business.
We also must focus on prevention. And again, when you think of disease and from a population health perspective, we really want to concentrate on how do we first prevent this disease. For far too long, it has been so stigmatized that we don't even talk about it. So we need to concentrate our efforts even at the earliest highest level within our school system. And Delaware was awarded a $10 million grant for the next 5 years to really concentrate on youth and prevention and education. So we really do get the word out.
Are we seeing more people, again, looking at the state numbers, seeking help from the state-funded facilities?
We are. Last year we had close to 10,000 people coming in for treatment. 30% of those actually have identified heroin as their primary source of addiction. So indeed, on the public side, we're seeing more and more, and that's why we have a capacity issue.
Given prescription painkillers seem to be this precursor to the heroin addiction, is there a way, Matt, where we can, I'm for private industry, all for business, but is there a way to prevent pharmaceutical companies from even developing new types of prescription painkillers when we already have so many out there on the market?
There is a more subtle problem, which is that we also have an extremely high rate in Delaware of prescriptions for opioid drugs that on their face are legitimate. For whatever reason, we have doctors in Delaware who choose to prescribe those drugs in amounts and for durations that are much, much higher than almost any other state. And that is something that we have begun to address. We don't do as poorly in comparison to other states as we did a year or two ago, but we're still not doing well. And I believe very strongly that we have to take some additional steps. You don't want to tell doctors how to do their work. But there's nothing special about Delawareans that should make them more needing of opioid drugs than others. And as Secretary Landgraf said, that is a gateway. I've been in the homes of people whose children started out car accident, prescribed painkillers, went off the painkillers, got on heroin and overdosed and died.
Well, unfortunately, our time is already out. Attorney General Matt Dent, DHS Secretary Rita Landgraf, thank you so much for your time. We're going to take a quick break, and then Mark joins the discussion with a story about Narcan.
Narcan has been proven as an effective treatment in dealing with heroin overdose cases on an emergency basis. To date, there is only one department using the drug, the tiny Sussex County community of Ocean View.
You do got to go to court on April 9th.
A routine traffic stop in Ocean View. The driver's insurance and registration card had expired. It is what used to make up the bulk of the police activity in town. For many years, Ocean View was known for just one thing.
25, 30 years ago, we were a farming community. In fact, our claim to fame is Ocean View is the birthplace of the broiler chicken industry.
Now, there are bigger issues.
We know we're going to see on the streets, whether it's off of a traffic stop or being called to somebody's house for some type of situation. Sadly, the drugs are everywhere.
At the beginning of my career in the late 80s, early 90s, a lot of violent crime associated with the crack cocaine epidemic. Now, within the last 2 years or so, we're seeing that same type of crime reoccurring. Now it's associated with the heroin epidemic.
Chief McLaughlin says the heroin epidemic is real, and it's not going away in the foreseeable future. He says his town went a decade without one heroin arrest. Now they make 1 or 2 arrests every week, and the addiction rate is growing.
I know wealthy people that are addicted. I know poor people that are addicted, males, females. So everyone's at risk.
The current heroin problem got its start with the abuse of prescription medicine. Then the problem got worse.
We started getting the overdose calls. We were really powerless to do anything until the paramedics got there.
Paramedics could administer Narcan.
Pop the top off of your injector. Your nasal piece gets screwed onto the injector.
Each member of the 8-man Ocean View police force gets 2 vials of Narcan to administer in case of an overdose call.
Take the top off of there. Just gets screwed into the injector to hold it snug. And then you're all set to administer the medicine. You put this inside of the nasal passage and just push up. Our job out here, as much as people might think, is just to pull people over. It's actually to save lives and help out the community. And that's 100% what the Narcan is for, especially with these opiate heroin overdoses.
Ocean View is the first department in Delaware to be certified to use the drug since a law allowing police to use it was signed last August. It cost the department about $100 per officer. Patrolman Caselli has made 1 heroin arrest since he joined the force in mid-2014. He has not used Narcan yet.
you never know when you're going to need it, whether it's in your own town or even if a neighboring town has an overdose. All the neighboring towns know that we carry the Narcan and would call us over there if needed.
You're going to see the Narcan programs grow and spread to other communities. I think they're going to be as prevalent as the defibrillators are.
He's proud of the fact that Ocean View is the first to use Narcan. He thinks more should be done in the way of drug education and increasing the number of treatment facilities for addicts. He also has a warning about the future.
This addiction, if you're lucky enough to beat it, it's a long-term effort. So I think this is something that we're going to be dealing with for quite some time.
Chief McLaughlin went to Quincy, Massachusetts to find out the best way to set up for his force to train for Narcan use. He has been approached by the Delaware State Police and Newcastle County Police, who expect to introduce Narcan use to their departments. One of our content partners is the Coastal Point. They serve the lower Delaware beach area. Maria Counts has written about heroin in Sussex County and joins us now. Maria, thanks for being here.
Thank you for having me.
So the piece focused on Ocean View and the police department's use of Narcan, but Ocean View is certainly not the only place in Sussex where this is an issue.
Absolutely not. You can see it in various department reports that get sent out. You hear about it at town council meetings, county council meetings. We hear it from the state police about it all the time. It's very prevalent.
And the chief talked about an old mailbox set up to collect prescription drugs that were old or not being used anymore. Is that something also that's going on throughout the county and other areas besides Ocean View?
Absolutely. It's a program set up through the DEA. I know that other local departments such as Dagsboro Police Department, Selbyville Police Department have those boxes. Ocean View does a really good job, though. They collect, I think, over a few hundred pounds of prescription drugs through that program.
You've also reported a lot about education programs that are out there for families and others to kind of be more aware of, I guess, of the problem and also Narcan and its use. So what's been the reaction from people who attend? A lot of people attending these meetings?
Few people seem to be attending these meetings. There's still a stigma attached to the heroin addiction, and so not everyone is coming out. Chief McLaughlin has really been encouraging the community to attend. And even if you're not immediately affected by the heroin addiction, it's still a great resource to learn and become more educated about the problem.
All right, Marie Counts, Coastal Point, one of our content partners here at WHYY. Thanks so much for being here. Appreciate it.
Thank you for having me.
The use of Narcan in Ocean View is just one of the stories written this month in Delaware Today magazine. Another is the story of John Dooling, a recovering heroin addict we first profiled on First last fall.
The last time I did it, I actually died for 7 minutes, and that was kind of like my wake-up call. Like, that's kind of when you get into recovery, you got to hit a bottom, and that was like the biggest bottom that I've ever hit in my life. My body not being used to it, I died. I actually fell out.
So what happened? How did you come back?
My friend actually was on task in level 3 probation, and he called the paramedics, and that was before that law got passed, and he actually got sent back to jail, but he saved my life.
Mark Nardone wrote the story for Delaware Today and joins us in our content partner segment. Now, you have 7 individual stories in this article. Which one made the biggest impact on you?
I think Chris Anderson's story. I knew a lot of kids from his neighborhood. I grew up with them. I understand the culture of that area and how it can lead to drug use. And I identify with Chris being a shy guy who is trying to find a way to feel at ease with himself.
Okay. Now, 3 of our stories this week follow the stories in your article. We just heard from John Dooling. He sends a powerful message. Anything intriguing to you?
Yes, you can die. Heroin will take your life, and not many people are going to be as lucky as John to come back from the brink of death.
So tell me, who's using heroin?
I think 30 or 40 years ago, we would have had a different idea about that. Today, the past 20 years, it's young people, suburban kids, and they are dying.
Anything you want people to actually take from this article? You talked to 7 people.
Yeah, I think if you have a problem, there are people out there who want to help you. they do care. If you're a parent, you need to talk to your kids, your teenagers and your young adults about everything that they do. You have to be open and honest, and you cannot judge them for the things that they do.
Oftentimes, as reporters, we sometimes can't cover everything or get to everything, I should say. Anything you did not get a chance to mention in your article?
Yeah, the depths of despair that people go to maintain their habit, the self-betrayal that they will sink to maintain a habit, and the negative self-image, I think, that sometimes leads to drug use.
Okay. Well, thanks so much, Mark. Mark Nardone's work can be found on the pages of Delaware Today or at delawaretoday.com. Delaware Today is a content partner of newsworks.org.
Attack Addiction is a resource and support group for families plagued by addiction, started by the Keisters, who lost their son Tyler to an accidental overdose. Don Keister is here along with Dave Humes, who sits on the board of directors. He too lost his son Greg to addiction. Now, welcome, gentlemen. Thank you so much for being here.
Thank you for having us.
The Department of Health and Social Services, their spokesperson Jill Friedel, just launched a statistic on me, and she said for fiscal year 2014, not only have we seen an increase in the number of people seeking public treatment for a heroin addiction, but that since 2010, the number of people seeking public treatment has jumped 108%. You speak with families who have either lost loved ones or have loved ones in recovery. When you hear these kinds of statistics, what now will you all talk about, how to move forward from here and how to address this rising number? Don, why don't we start with you?
Well, it's not something that we're surprised about. I'm glad that they're starting to put some facts and figures together so that they can monitor exactly what needs to be done and take steps to help these people that are in dire need of assistance.
And it attacks anyone. I mean, no one is immune from the disease of addiction. Is that right, Dave?
Right, and that's the stigma that we're trying to break. People have this stereotype of what a heroin user or an opiate user is, and really we just have to shatter that.
I know that you both lost your sons, but looking at them, you wouldn't say he used heroin, or he looks like he might be at risk for using a drug, a particular painkiller.
Yeah, you never think that's going to happen to your own child. We notice that these people seem to have similar characteristics. They seem to be risk takers. They seem to be very kind and helpful. They seem to be fairly intelligent. Again, it'd be nice to have some statistics to try to evaluate some of these things that go on.
The state's taking a number of steps to filling gaps towards drug treatment. Where do you think the state needs to go from here? Where are we still falling short?
Well, I think we're going to add another detox center June 1st, I believe, and I think each county needs to have a detox center. And one of the areas we're falling short a little bit that we've been talking about recently is when people come to you for help and they can't get in anywhere. That's when you got to get them right at that very moment. If you wait 2 or 3 hours, they're going to be gone. So if we could have a facility that is temporary to house them until they can get into long-term treatment so they don't get away and they don't go back to the street and they don't start using it, I think that would be a big step forward in easing, some of the problem with the heroin.
Did both of you run into those problems?
Well, I couldn't find anything in the state. We had to go out of state for any assistance we got, and we had trouble finding that.
Good. Well, gentlemen, I'm sorry, but we are out of time already. Don and Dave, thank you so much for your time and for all of the amazing work that you do through Attack Addiction. If you want to learn more to help yourself or a loved one, go to attackaddiction.com.
Everyone during this program has spoken of the need for more awareness of the heroin issue. Our final story on First this week is about educating the public.
There's a $500,000 public education campaign set to kick off this summer. With more on drug education, here's Delaware education reporter Avi Wolfman-Arent.
Thanks, Mark and Nichelle. Over time, there have been programs dealing with alcohol and tobacco use all the way up to marijuana and cocaine. But Newcastle County wants to target middle-class students in their latest heroin education efforts.
For whatever reason, Aaron tried it.
For the past 17 years, Marie Allen has visited hundreds of schools in the Mid-Atlantic to talk about her daughter.
I've been doing these talks and telling Aaron's story because I think that young people deserve to hear the truth about how alcohol and drugs can affect your life.
Aaron's story is horrifying. It starts with alcohol abuse at age 15. It ends with a heroin overdose at age 21. And when she describes Aaron's downward spiral, Marie doesn't spare the details.
While she was in Kensington, she sold my car for $200. She had been beaten, raped, and left out in the street.
Tonight, her audience is the 8th grade class at the Independent School in Newark. A private elementary and middle school on a sprawling suburban campus may seem like an odd place for this kind of tough talk, but the point is to reach exactly these types of students. Students like Rihanna, who left the presentation troubled.
What was going through my head was that the girl was just basically a normal girl and that she just was asked to take a drug once and then couldn't stop. So that's what it does to you. And she sold her mom's car. So it was really important to her to, that's how it can ruin your life. So that was really saddening to hear that it can happen to anybody.
I want them to realize that it can happen to anybody. We were just normal. We were just a normal family. Well, we've never been really that normal, but I mean, you know what I mean. We're just normal middle-class family.
Marie has done this presentation at least 1,000 times, she says, maybe 2,000. It hasn't changed much since she started, but the context around it has.
I didn't think this would happen. I didn't think a pill could start all this.
This commercial is part of a $500,000 ad campaign launched by Newcastle County in early March. It's the county's biggest anti-heroin education initiative ever.
I didn't think I could use a needle.
The imagery is intentionally suburban. That's because the demographics of heroin users have shifted dramatically since the 60s. According to a 2014 study, a drug once confined to the inner cities now largely afflicts white suburbanites. Many trace their addiction to prescription pill abuse, which can lead to heroin.
We're responding to middle America, if you will. We're walking into 123 Anywhere Street in Hockessin, in Centerville, in Newcastle, and it's very clear to us who's doing heroin. Very, very young, mostly white folks, and they're dying from it.
A 2012 survey of suburban heroin addicts found that most had little to no direct heroin education. Marie Allen has been working for years to correct that. With the help of Newcastle County and its new campaign, her soapbox just got a little bit bigger.
Life is all about choices, and we want to stress that one wrong choice can change your life forever. Thank you.
The Newcastle County campaign is set to run for a year. Future funding is a question mark.
Thanks so much, Avi, and that is our show about the ongoing heroin issue in Delaware. We hope you'll read more online at newsworks.org/Delaware. For Nichelle Polston, Mark Eichman, and Avi Wolfman-Arndt, I'm Shirley Min. Thank you for watching First.